Strickland, we begin tonight with a new report on prostate cancer deaths in South Carolina. Now, according to the State Cancer Alliance, the numbers have decreased by 50% over a 25-year period.
Tonight, Becky Buds has reaction from doctors and survivors.
67, and I'm renegotiating my contract with God because I'm trying to get here another 60 years.
Lee Moultrie looks forward to anything that keeps him active. His health journey started in 2015 after he was diagnosed with prostate cancer.
In my community, we call that a blessing because it was a low grade. So I ended up doing watchful waiting and/or active surveillance for 6 years before I decided on treatment.
In 2022, he became cancer-free, though his mission of advocating for more cancer screening and awareness began long before that.
God has blessed me to do this. It's because I want people to have a good life. I want them to have a long, healthy life.
It's a story of prevention and education that many Black men aren't alive to tell in South Carolina. According to state data, Black men are more than 2 times more likely to die from prostate cancer than white men.
Very challenging for patients because it's a disease that I don't think we have fully understood in the past.
Dr. Johnny Lindquist with Prisma Health says mortality rates are declining.
We're really just, I think, catching it earlier, treating it better, and preventing it from getting to that castrate-resistant point.
State lawmakers are now looking at ways to lower these rates even more. Beth Johnson with the American Cancer Society says options include expanding Medicaid, increasing education, or requiring health insurance to cover prostate cancer screenings in high-risk men.
You know, it's certainly one thing to be able to bring men in and to screen them, but then what's next? So then how are the men going to receive treatment if they don't have insurance, or if they don't have adequate insurance?
Reporting in Columbia, Becky Buds, News 19 WLTX.
Well, as of January of last year, South Carolina had an estimated 260,000 cancer survivors, and overall cancer-related deaths decreased by 25% in a 25-year period. However, South Carolina still has the 11th highest death rate from cancer in the country. The most common type of cancer for both men and women, lung cancer. So far this year, more than 2,600 deaths were reported from lung cancer across the state. Lung cancer rates were consistently higher among Black men than any other group.